Hello, everybody. Thank you for asking me, Pascal, and thank you for giving up your lunchtime to hear me talk today. I hope at the end of today, when you hear people talk about low carb, you realise it isn't a fad and it's actually an incredible tool that if you work with unwell people on antipsychotic medications, people with metabolic syndrome, you can offer them this really powerful tool. So I'm going to be talking to you about therapeutic carbohydrate reduction and the research that we've been doing in the Mid-North Coast. I'm a general practitioner and I've been a GP for about 25 years, and I've really seen the health of our community go downhill in that time. As a GP, you're alone in your room, and outside is what I would call a tsunami of metabolic syndrome, and you're expected to fix it sitting alone in your room doing a care plan. And what we see is everyone's the same. Everyone's got high blood pressure, sleep apnea, fatty liver disease, high triglycerides, low HDL, kidney failure, heart disease. They're all on exactly the same. And I write little scripts for all these diseases that are really essentially the same. They're all metabolic syndrome. I watch my patients get sicker and monitor that decline over the years. That's what you do as a GP. And I used to think that was my job, just to make sure everyone was on all the right tablets. It's quite depressing. But then in 2018, everything changed for me because I discovered the low carbohydrate diet. I've always been trying to get my patients to lose weight and to eat a healthy diet, eat less, move more, Mediterranean, nuts, seeds, fruit and veg, lean meat, but it didn't work. Nothing worked. And I've pretty much given up. And then I discovered a low carbohydrate diet. So if I said to my patient with diabetes, what about if you prioritise protein, you eat above-ground vegetables, eat as much fat as you like, but I don't want you to eat any grains, potatoes or sugars. And patients could do it. And all of a sudden, they were getting better. Their liver function test went from fatty liver to normal. Their blood pressure got better and I could stop their blood pressure tablets. Within a week, they would come back and go, I'm not hungry anymore, or my hands don't hurt anymore, or my reflux is gone. It was like a miracle and mind-blowing. I just couldn't believe it. So I became this sort of low-carb fanatic, and that is really all I do in my practice now is I focus on people with diabetes, and I have a lot of fun. I just want to point out how easy it is. If you've got someone with type 2 diabetes on insulin, often we can get them off the insulin within about a day. Sometimes doctors who don't know about this will say, oh, it's just the weight loss, and you go, no, it was a day. The reason being a lot of people are eating wheat bix with toast for breakfast, which contains a lot of glucose, and they have to inject insulin to cover the glucose. So what about you have an omelette and then you don't need the insulin? That's how easy it is. Patients say to me, why has no one ever told me this before? Because they think they need to eat porridge, and porridge requires insulin. So this is how simple it is. So this is Deb. She came to see me in 2020. She's got all the features of metabolic syndrome. She has cirrhosis of the liver from fatty liver disease. She's on 100 units of insulin a day for her diabetes. She's obese. She's got high blood pressure. She's got metabolic syndrome. Now, in the past, I would see patients like that and feel just depressed because what can I do to help them? But now I love these patients. I explained to Deb, do you want to give it a go? She was off her insulin, 102 units within 48 hours because she didn't need it. I always halve it on the first day. They tell me what their sugars are and I go, you're fine. People say it's not sustainable, but guess what? Lots of people can do it if you give them a go. And here she is, this is 3 years later, looking like a different person. She's lost 20 kilograms. She remains off her insulin. 2 of her blood pressure medications have been stopped. And you can see her HbA1c there, her diabetes control. It was perfect very quickly, 4.8, and it remains perfect. And the liver doctor wrote this letter because liver specialists aren't used to seeing people get well. And he wrote all the appropriate blood parameters have improved amazingly. So you see the word amazing because they're just not used to this. Her blood glucose and her liver function tests have even improved. And he noticed that her INR had improved, showing an improvement in the synthetic function of the liver. The nurse who does the fibro scans here is going to become a nutritionist. because she's seen that the keto diet gets people looking like they have cirrhosis to a normal FibroScan at 9 months. It's really powerful. Checking results is fun. So all your patients with metabolic syndrome, instead of looking at the LDL cholesterol, why don't you have a look at the triglycerides and the HDL? That's what people with metabolic syndrome have. High triglycerides, low HDL, because they're sick, they're metabolically unwell. When you go on low carb, almost immediately you see the triglycerides drop, and then after a few months, the HDL pops up. Their whole physiology has become healthy. So you worry, people say, oh, they're eating eggs, what about their cholesterol? And I go, what about their triglycerides and their HDL? They're going to become perfect. And in case you think I'm some crazy zealot, it is very science-based. The Australian Diabetes Society, which represents endocrinologists, has a guide, Managing Type 2 Diabetes with Therapeutic Carbohydrate Reduction. Diabetes Australia is promoting here, so it kicks off a partnership with Defeat Diabetes. So Diabetes Australia is in partnership with Defeat Diabetes. What's that? It's a low-carb program. The American Diabetes Association has a handout, low carb and very low carb eating patterns in patients with diabetes, a guide for healthcare practitioners. It's mainstream, it's just not being offered to anybody. You ask your patients with diabetes, anyone told you about low carb? No. So what is it? What's this therapeutic carbohydrate reduction? I try and make it really simple. I just tell patients protein is your friend. So you can have as much meat as you like. I don't care if it's red meat. It is fine. You can have chicken, you can have fish, you can have tuna, as many eggs as you like. People go, oh, can I have more than 1 egg a week? How many bits of pizza are you eating? You can have 10 eggs a day. It's going to be healthy for you. So you make it really simple. Protein is your friend. Get out your barbecue and just start putting things on it. Vegetables, just make them above ground. And then fat is your friend. So cheese is fine. Cream is fine. Olive oil, if you're worried about eating cream. So protein, above ground veg, and fat. And then no GPS, no grains, potatoes, and sugar.
And that includes no sweet potato, doesn't it?
Yes, so sweet potato is below ground. Mm-hmm. But honestly, that's not the devil. The rice crackers are the devil. But it's actually very carby, more carby than a potato. So people think sweet potato is worse, but it actually isn't.
So it's no grains?
Yep, potatoes or sugars. GPS.
No sugar.
So sugars as in what about fruit?
So look, if I've got someone on insulin, I really want to get them off it. You can't have fruit because it's sweet, isn't it? That's glucose. People go, what about honey? It's natural. We're just playing with your physiology. And in these people with metabolic syndrome, their system for using glucose is broken. Okay, so if you're a healthy person, fruit's fine. But if you're someone struggling with metabolic syndrome, fruit isn't your friend. The above ground vegetables got plenty of fibre. Berries tend to have less sugar. But yeah, this whole idea of fruit's great. Have you seen how sweet fruit is getting? The scientists are mucking around with it. It isn't the way fruit used to be. So I'm afraid fruit, better to avoid the fruit.
Or else sitting if you can be potato.
Just prioritise protein above ground veg and you're halfway there. You don't need rice with your dinner. So what about saturated fat? Because we all think, gosh, we've got to have light milk, don't we? Actually, no. There's been a study of people who have full fat dairy have less coronary artery calcium. So they got it wrong on saturated fat and drove us to eat margarine and rice crackers. Probably drove this whole metabolic crisis. A review by the Journal of the American College of Cardiology by prestigious authors, some of whom had been on previous dietary guideline committees. They looked at all the evidence and they said there's no evidence for an upper limit on saturated fat consumption. And foods like full fat dairy, meat, they're not associated with an increased risk of heart attack or diabetes. And did you know low fat diets are associated with more strokes? So nobody tells you that. The fat's your friend. So this is Brooke. She's a fourth-year medical student at the University of New South Wales, and she did her honours year with me. We looked at whether this way of eating is safe for people with chronic kidney disease. This came about because a kidney doctor was going, oh, they're eating protein, that's bad for kidneys. But then he saw that his patients were getting better because kidney function improves. But they're now calling most kidney disease metabolic dysfunction associated chronic kidney disease. So if you improve their metabolism, their kidney disease improves. And a lot of it is inflammatory. So this diet reduces inflammation. So you get their diabetes in remission, their kidney function improves. So the kidney doctor went, oh my goodness, this is fascinating. We should do a study. So Brooke came along and went through all the patients that had kidney disease, had been on this diet for at least 3 months. The average time was a year, and we saw it was safe, kidney function improved, patients came off their medications, and that's Brooke at the Diabetes Congress meeting with her poster. And we published it in the Journal of Metabolic Health. This is our medical student the following year, Khaleesi Miller. Interestingly, a urologist in town, Nader Awad, and what he tells people how to, when they need surgery, so he's doing deep surgery in the pelvis and he needs people to lose weight. So for years he'd been trying to get people to lose weight, no one could. But now he gives them a handout and 5-minute explanation of a low-carb diet, and he's finding that they all lose weight rapidly before surgery. So Khaleesi, he kept all the data, Wayne at the time of consent, Wayne in the day of surgery, and Khaleesi went through that and saw that it was very effective. She rang patients 6 months later and found a lot of them were staying on the diet. They found it really easy and they found it quite life-changing. So she presented her findings at a urology meeting. So the effectiveness of a 5-minute low-carb diet recommendation for rapid weight loss prior to abdominal and pelvic surgery. I just want to point out, because people think it's hard, it's complicated, no one can do it. Maybe that's because no one's given them a chance, given them a go, encourage them. A lot of people can do it. Some people can't, but a lot of people. So now we're planning a diabetic eye disease study. People with diabetes get swelling in the back of their eyes and they have to have an injection in their eye every 6 weeks. Isn't that awful? So we're going to look at whether reducing carbs in these patients means they don't need these injections. It all came about because of James Yuki, who was Australian of the Year in 2020, and he's an ophthalmologist and he loves low carb. And he'll tell his patients with diabetes with this swelling in their eye, why don't you go on a low carb diet? And he'll send them to an nutritionist. And he sees that their eye disease gets better and they don't need the needles. And I know him because we go to these low carb conferences. He's published a case report, diet-induced resolution of macular edema following remission of type 2 diabetes in a patient undergoing therapeutic carbohydrate reduction. So what we're doing is we're planning a study in Macquarie, Wagga and Adelaide. A low-carb GP will pair with an ophthalmologist, and we're going to get these patients on a low-carb diet and follow them up for 6 months and see if we can improve their eyesight. And Peter Fletcher from Armidale Unis, we're going to look at it qualitatively and see how patients find it. We're currently meeting. It's a pilot study. We were going to do randomised, but then we realised that's ridiculous to start a pilot study. I don't know if any of you done research, but it's really exhausting. And we're 45 patients, carbs for 30 grams a day. We're just trying to get ethics through at the moment. We'll see how that goes. Another thing I'm involved with is a grant application. Karen Dwyer is a kidney specialist in Melbourne and she loves low carb. So she's a professor. She used to be the head of Renal Kidney Health Australia. So again, it's good for kidneys. So she says it's amazing. And so she's wanting to get 3 centres and getting patients who are at risk of kidney disease onto a low-carb diet, and that's what she's putting a grant in for. A lot of people are on board with this, kidney doctors, professors. It's not weird, it's the future. And then finally, this is what I think is the most exciting, metabolic psychiatry. Now, there's a young man in America whose family owned roadblocks. Their son went to uni and developed terrible treatment-resistant bipolar disorder. He was living on the street, in and out of treatment for 5 years, saw the best doctors in America. Finally, someone said to the mother, I went on the ketogenic diet and that put my bipolar into remission. I don't know if you know that the ketogenic diet is an established treatment for epilepsy. So we have ketogenic diet clinics in Children's Hospital. We know ketosis fixes seizures, and we use epilepsy drugs in bipolar disorder, don't we? Sodium valproate, lamotrigine, they're all psychiatric meds. The mum went, okay, I'm going to put him on the ketogenic diet. And he went into remission, remains in remission 5 years later. So they, with all their wealth, have gone, okay, we're going to fund this science. Because you see, the problem with food is no one's going to pay for the science. That's why we're all driven by drugs. The only people who can pay for evidence-based medicine is the drug companies. But now we have the rolling rich roadblocks. They're paying for the science. They're paying for neuroscientists and doing randomized control trials. We've got one at James Cook University. They're nearly finished recruiting 100 patients with schizophrenia and bipolar. 50 are on a healthy Australian dietary guidelines diet. 50 are getting a ketogenic diet, aiming to get your ketones high. And we're going to see how they're going. Now, one of the chief investigators gave a presentation recently to our Metabolic Health Society, and they're seeing really exciting results. People getting jobs, people tidying up their homes, like life-changing. So this science is coming. They've just done a study at Duke University with depression in young people at university. They've all improved. They've all improved. Metabolic Mind, if you're curious and you want to know more, you just go to Google Metabolic Mind. This website lists all the studies, everything you need. If you've got clients that are curious, send them there. It's got resources for all patients. And that is currently my great love. I've got 2 patients with bipolar disorder, and their depression goes really fast. When I have them with depression, within a week, they're feeling better. But it's different to that low carb diet that I talk about with diabetes, because you need these things called ketones. And that's a bit harder to get. You need to moderate protein and you need more fat. So it's a little bit trickier, but it's not hard. It's just being alone. So finally, I just want to thank University of New South Wales. It's been so supportive. Yeah, and look, we all love Ozempic, and it does make people drink less alcohol. I've really noticed that. So I'm sure in drug and alcohol, you'll be soon having to give everyone Ozempic. But I'll tell you what, steak and eggs is pretty powerful too.